This is Angela Waters-Kaufer, and today I'm going to share with you some information about a medication app that's available on your smartphone or tablet. Micromedex has been a very helpful tool. I used this application while I was a nursing student and continue to use it as a registered nurse on the cardiac unit. This application is available through the App Store for free when you have a Micromedex 2.0 subscription, or for the low price of $2.99 a year to those that do not have a subscription. Micromedex allows you to search medications by name, class, or you could just scroll through the list of medications. Once you've selected the medication, there are many options available to choose from to obtain more information. Some of those categories, to name a few, are dosages and indications, drug interactions, monitoring, and clinical teaching. At my place of employment, Micromedex is a reference tool available to physicians, nurses, and anyone interested in the content. This application is very helpful to nurses as a reference. I myself use this application at least once a shift to check the compatibility of IV medications. To access contraindications, all you have to do is select the medication, drug interactions, and then select contraindicated. You will then see a list of medications that are not compatible with that medication. This is a useful tool to people that administer IV medications, because some combinations of medications could be lethal to a patient. Another helpful feature of this application is the monitoring section. This feature warns and advises the user on signs and symptoms to look for while taking this medication, as well as lab results that are recommended to monitor. There's also a function that goes over recommended clinical teaching that you could use to educate your patient. Micromedex is very user-friendly. Once you have downloaded the application, it will be ready to use, and there is no worry of in-app purchase requirements or advertisements. It is recommended to check for updates every 30 days, but once the application is downloaded, it no longer requires internet access, so you can access the content of the application even if you do not have cellular service. The layout of this application is very simple and easy to use. The first screen on the application shows a list of medications available to search. If you are unsure how to spell the medication, once you start typing, the application will suggest medications that you could be looking for. Once you find the medication you're looking for and select it, you will be taken to a screen that gives you a list of choices to select so that you may view more specific information. As long as you maintain the current updates, the application runs smooth without delay in between screens. The information in this application is easy to read and understand and is comparable to the language you would see in a current medication drug guide. After searching several different terms and subjects on legal or ethical issues involving Micromedex, I was unsuccessful in finding anything on the topic. Perhaps the reason that there have not been any issues is due to the fact that Micromedex does not collect or store any personal information. The app is specifically for a reference on medications and their uses. When compared to different medication applications, Micromedex always ranges at the top of the list for evidence-based practices. Micromedex has been evidence-based for over 40 years, is trusted in over 5,000 healthcare institutions, and is incorporated to almost 2,000 electronic medical record systems. According to a study published in the Journal of Medical Library Association, Micromedex continues to rank in the highest percentile for obtaining the most complete and convenient source for medications. In regard to this application, I would absolutely recommend Micromedex to other nurses and colleagues in the medical profession. In conclusion, Micromedex is a very user-friendly application that is available to everyone at a very low cost. Its functionality is proficient, reliable, and appropriate for its purpose. Even though this application is a very basic application, it can also be life-saving with its many features to educate the provider on interactions of medications, contraindications, and monitoring recommendations. I appreciate you listening to this presentation today, and I hope that your new knowledge on this application can assist you in your profession.